Good morning, Chairman. We're ready to begin.
Good morning, Janisha. If you'll conduct the roll call, please.
Yes, Chairman. I'll begin with Roger Folsom,
Here.
Norman Boyd,
Here.
Tommy Hopkins,
Here.
Cynthia Rucker,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Robert Coles, He dialed in via phone, so he just may not be unmuted right now. Kathleen Ruth,
Here.
and Mr. Mobley. Hi. Mr. Mobley's taking his seat, Chairman.
Mr. Mobley made it by the bell.
Yes.
I know, right, Roger?
Thank you,
Well,
Chairman.
we certainly,
Roll call.
it looks like if Dr. Coles is on, we have 100%, so we certainly have a quorum. So hereby we call the meeting to order. We will now have the minutes from our November the 14th meeting, and Dr. Hopkins will have those.
The minutes have been submitted. Of any additional corrections? Mr. Chairman, present to you for as a motion.
Okay. You'll make that in the form of a motion. So we have a motion for approval of the November the 14th minutes. Do we have a second?
Second. Dr. Rucker.
Dr. Rucker has seconded. Any further additions or corrections? Hearing none, all those in favor of the motion signify by aye.
Aye.
Opposed, no. Motion carries. We have one item to consider for final adoption today on our agenda. So we'll have a relatively short agenda, but we have some important things on the agenda today. And look forward to those things later. This morning at 9 o'clock, the audit committee met, and David Cruz will give us a report on that. He's the chair.
Thank you, Mr. Chairman. This morning, the audit committee met for about a half hour, and we heard updates from Inspector General Sonia Allen Smith and Director David Chong on ongoing audits. There are 4 audits involving the Centers for Medicaid and Medicare Services, CMS. One of those has been closed out, and there are 3 ongoing audits. And all reports were favorable in terms of those audits. Nothing major that came out in terms of findings or issues. And then we also heard reports on the audits being conducted by the Georgia Department of Audits and Accounts, DOAA. There are 2 performance audits that are ongoing, as well as the annual Georgia Comprehensive Financial Report and single audit that is being conducted annually, and it will be the spring before we have a report on that audit. What we did do was we heard reports on previous year's audits by DOAA. There have been 5 outstanding findings that the department has been addressing. All of them have been partially resolved, and the expectations are that they will be fully resolved in the future. One of those is waiting on approval from CMS, and one is would be resolved once the new award for the care management organizations is that contract, once those contracts are issued, that one would be resolved. So overall, we heard some good reports from the department's progress on the audits, Mr. Chairman.
Thank you, David. Any board member have questions for David? Hearing none, we'll move on to the commissioner's report. Commissioner Carlson, good morning.
Good morning. Good morning. Thank you, Mr. Chairman. And Denise, I'm sorry I sat in my wrong seat. Don't let the name plates fool you. He's Shane Mobley and I'm Russell. But that's on me. Sorry about that.
I wondered if the coup occurred this morning.
We just wanted to keep it interesting, see who was watching. No, thank you, Mr. Chairman and members of the board. And as always, everyone joining us virtually today. And as you can see, we are honored to have several of our board members join us in person this morning. Appreciate them taking the time to come in with the little travel involved. So really appreciate that. And as Mr. Chairman alluded to, I think a little later in our meeting, we'll help shed a little light on as to what brought them here this morning. And we look forward to sharing a little joy and celebration with you all shortly. Well deserved. As is the case for many of you watching today, the end of the year brings with it a bit of a scramble. Elections, transition, finalizing our preparations for the upcoming legislative session, all while the numerous tasks of our daily busy various positions still mount and must be attended to in a timely manner so we can still meet the needs of the Georgia families that rely on us. Needless to say, December has been busy. Earlier this week, several of our leaders attended the Biennial Institute in Athens, where legislators, both newly elected and currently serving, gathered to undergo training and numerous education sessions on important policy matters in preparation for the session's deliberations. I myself actually participated in a briefing on the healthcare landscape in across Georgia just Tuesday morning. Additionally, yesterday, we were also in Athens. We were treated to a wonderful tour and joint discussions with our partners at the new medical school at UGA, as well as an in-depth visit with the Carl Vinson Institute of Government. I want to especially thank Dean Shelley Nuss and our very talented and engaging team for their time. We look forward to seeing more of their team and collaborating with them on the many priorities and passions we both share. And I'd also like to especially thank Drs. Rob Gordon and David Tanner at the Carl Vinson Institute for their hospitality as they coordinated all the visits and the Biennial Institute itself and spent time with us discussing the priorities we both share. We sincerely value their team and the long-standing and active partnership with us in UGA. Now I'd like to pivot to one more very important piece of business. Earlier this month, after literally years of thoughtful work and evaluation, our partners at the Department of Administrative Services, DOAS, announced the results of our procurement for the Care Management Organization contracts, the vendors chosen to manage our Medicaid population. This is the state's largest procurement, and it is one at some point in the future that will determine who is managing roughly 90% or more of our Medicaid population. The results are as follows. Molina, CareSource, Humana, and United Healthcare are the vendors chosen through evaluation to manage the Georgia Families Contract, which is the contract of largely of the Medicaid population, while United Healthcare also was selected for the Georgia 360 contract, which pertains primarily to the foster care population in our state. And I want to be clear on something at this point. This is the beginning of the process and not the end. Right now, we find ourselves in a sensitive protest period where vendors are allowed to speak to the results in the process. DOAS will then have a period to evaluate these protests, and as you'd imagine, this could potentially take some time, and frankly, it is an important matter that warrants deliberation and review. It is important to note that the process and the mechanics of this matter allow significant time for the implementation of these transitions because there are many transitions potentially set to take place. New vendors with new Medicaid members. There'll be populations of Medicaid members that are not currently in managed care who will be transitioned into managed care. Some at the beginning of the new contracts and others into year 3 or beyond of the contracts. Negotiations, discussions will be abound, and I can assure you, there'll be town halls, outreach opportunities, multiple opportunities to exchange thoughts and questions as to how all this should be done and how we can best achieve this together. While we cannot speak at a certain time to a date certain of protests and appeals being finalized, we can state that the department has made strides to keep the current contracts, a steady state, if you will, in place for as far out as the summer of 2026. So I ask everyone to continue monitoring the information flowing between us and DOAS and to the public. Participate when you can, and through collaboration, communication, and frankly, time, I'm confident we can make responsible decisions together that will serve Georgians best. I want to thank specifically Lynette Rhodes, LaClois Bowler, and Brian and Eno and the entire legal team for being as engaged as they have for multiple years, literally. I want to give a heartfelt thanks to our evaluation team, a group of subject matter experts whose technical and clinical experience were invaluable to this effort, as well as DOAS Commissioner Rebecca Sullivan, and namely Carrie Steele, Matt Carter with her team for being with us every step of the way so that we can all collectively as taxpayers be confident in the procurement and know that it was a deliberative one and an ethical one and one that we look forward to seeing through in the months ahead. So, Mr. Chairman, if I may pivot away from that and move into a little bit of a special recognition here in December. We're all making merry and we're all excited as we reflect on the year behind us. So if I may, Mr. Chairman, I'd like to take a moment to call up my colleague Anthony Moss for a moment, for a quick moment of special recognition.
Please do.
Thank you. We'll move to the mic here, Anthony, so we can make sure everything's captured. As many of you know, Anthony serves as a leader in HFRD, but I think Lisa, the chief of HFRD, would agree that a particular title doesn't really do it all justice. As our team tackles so many things together, there are a lot of Swiss Army knife kind of moments where we're all getting in and tackling things as one and seeing it through. What brings us here today is Anthony has a special role in addition to his HFRD responsibilities. He is our GMA lead. He is the point person in emergency situations, which unfortunately there are many, and that number's increasing. He, alongside our partners at Public Health and many of our stakeholders, the hospitals and the long-term care community, jointly tend to emergencies, make sure that in these periods of uncertainty that we cannot control, that people are still receiving care. As you would imagine, nothing goes as scripted. In fact, there is no script to begin with. There are decisions that are made overnight. There are decisions that are made that you didn't see coming only moments before. And Anthony, along with his team, makes thoughtful, responsible decisions through GMA and through the leadership there to make sure that everyone is being cared for. And also to take an additional step to make sure that that families are communicated with, and that everyone knows that they can have confidence in the state's response to any of these situations. Anthony, it doesn't go lost on us that those are overnight situations. Those are time away from home. You never know, as they say, when the balloon's going to go up, when the next emergency will be before us. Obviously, Mr. Folsom is very passionate about the latest series of storms in the Dublin area, and knows firsthand of the impact that makes, obviously, on the community at large, but specifically to the healthcare systems there locally, and how it's paramount that people still get the needs tended to. So on behalf of the entire organization and the board and the governor, the state as a whole, I'd like to present this with you, Anthony. I don't have my white gloves with us, so sorry if there's a fingerprint on there. But I'll read it for everyone, what the very nice plaque says here. 2024 Inclement Weather Season Appreciation Award, presented to Anthony A. Moss, Deputy Director and GMA Liaison for the Healthcare Facility Regulation Division. In recognition of your outstanding commitment, teamwork, collaboration, and community engagement. Thank you, Anthony.
Thank you.
Appreciate it. This plaque doesn't do it all justice, but I hope you'll take this with appreciation.
Thank you. I appreciate it.
Thank you. Of course. Thank you for all you do, and thank you, Lisa. Thank you, Mr. Chairman, and if it's okay with you, I believe you may have a few further comments for us, Mr. Folsom, in the spirit of recognition and thanks.
Yes, thank you, Mr. Commissioner. Anthony, I want to add my congratulations and appreciation to you also. Certainly on behalf of the board, but personally, I hear your name and know personally too of your work, and greatly appreciate all that you do for the state of Georgia and our departments. And we just appreciate you going beyond the call of duty in many cases. Also this morning, Commissioner and I have talked. We want to recognize our past chairman, Norm Boyd. Norm, I want to take a personal note to thank you for your guidance and mentorship over all the years I've been on the board. And you were one of the smiling faces I first met the first day I arrived on this board, and I've appreciated you over time. And I am so happy that you're going to be continuing to serve with us also on the board. You're not going anywhere. We're not conducting a funeral this morning or anything. So you're going to be with us, Norm. But thank you for your leadership as a long-term chairman of this board. But more importantly, Norm, I want to thank you for becoming a personal friend. Appreciate that more than you will know. And I will yield to the commissioner for some more formal remarks.
Thank you, Roger.
Thank you, Mr. Chairman, and I'll add to that, and then obviously I want any of the board members, but obviously these present today to speak as well. But Mr. Boyd, I think Chairman Folsom and I may have some kind of similar sentiments in the sense that he was involved, Mr. Folsom, on the board for some time and then took the role as chair. I've been involved in state government for some time and even with the department itself before I took this role. So I'd been around, but new to this. And sometimes when you're present and you're around, people just assume when you transition to these bigger roles that, you know, day one, you've kind of got it all figured out. And as the staff saw firsthand, I did not, and I do not have it all figured out today. But you never forget the friends and the counsel that you received early and the encouragement that you received early when some of these earlier meetings where the palms are sweaty and you're trying to kind of navigate your way through these things. I want to make sure everyone also appreciates the numerous things you do when no one else is looking. You were always looking out for the department, but I'd take it a step further and you were always looking out for truly just the health and wellness of the state. Whether it be a phone call of something you'd heard, an article that either encouraged you or troubled you, you're always quick to share with us your thoughts of what was taking place in the state. And again, encouraging us when it was something we should have been proud of, but also challenging us to do better when we saw that Georgia probably could stand to do a little better. And you never asked for any credit or recognition while doing that. And so in these challenging times, I think we're always encouraged, especially this time of year when you can look at someone and still remember that there are true selfless public servants out there, just especially in your citizen capacity and doing this board on basically a volunteer basis. You committed a lot of time to this for a long time, and we're, as Mr. Folsom said, we're glad you're not hanging that up yet either. So thank you for everything. And I do, if I may, I'd like to present this to you and then hand it over to the board members for a few comments. So, Mr. Chairman, I think the microphone can get me from here. I'd like to read a couple of things. I do have a plaque here, and then we have a proclamation from the governor that I'd like to both read and share with you as well. With sincere appreciation and gratitude for many years of dedicated service as chairman of the Board of Community Health, November 2012 through October of 2024, presented to Norman L. Boyd from fellow board members, Commissioner Russell Carlson, and the Department of Community Health. Thank you, Mr. Chair.
Hey, Russell, thank you so
Yes,
very
sir.
much.
Of
And,
course.
yeah, and thank you, Roger, for your comments. And Roger and I have become good friends, or a lot of time over the phone the last few years, but he's always been so supportive of things that we're doing. And when I wanted to really know what was going on, I could ask Roger, because he always knew a little bit more. I come from the private sector, corporate background, not the healthcare background, but appreciate all the people that have helped educate me from this board who have more experience in this sector in healthcare service than I've had. But also my real that I take away from this is the friends and the people that I've met in the Department of Community Health that have been so dedicated to carrying out the mission that we have of supporting a healthy Georgia, because the people in this department are really dedicated people. And I've certainly learned that over the years. And thank you all so very much.
Yes, sir. And if I can, we got one more for you, Mr. Chairman.
Okay, gee, thank you.
We have a commendation by the governor that I'd like to share with you. Whereas Mr. Norman Boyd served honorably for 12 years as chairman of the Board of Community Health, engaging board members to work as a unit on behalf of the citizens of the great state of Georgia. And whereas Mr. Boyd facilitated board meetings while demonstrating excellent leadership and oversight while following effective governing practices to consider and vote upon proposals presented to the board by staff of the Department of Community Health. And whereas Mr. Boyd supported the mission of the Department of Community Health, embodied its vision and purpose, managed the formation of various board subcommittees for performance of specific responsibilities, and governed board matters with clarity. And whereas it is fitting and proper to recognize Mr. Boyd as a pivotal advocate of accountability and exemplar of fiduciary responsibility in his duties as chairman of the Board of Community Health, therefore I, Brian P. Kemp, Governor of the state of Georgia, do hereby commend Mr. Norman L. Boyd.
Thank you. Thank you. Thanks. Thanks for the governor.
Of course, of course.
Thank you.
Would any board members like to make any comments?
Well, I'll echo what's been said. It's been a pleasure being on the board for a number of years, and until this recent change, I've always had the pleasure of serving with Norm as our chair. And I didn't really know much about the role when I joined many years ago, but I was able to kind of see the behavior and how Norm conducted the meetings and what he asked for us, and kind of quickly kind of gathered, what the role would be, and always looked to him as sort of that guidepost for our board members. We didn't always see the work that he was doing in addition to, what we as members were doing as chair. We know that takes a lot of additional time, and, we appreciate all of that. I appreciate the opportunities that you've given me with the Care Management Committee and the Nominating Committee, and being able to serve on those and provide additional leadership. And it's just been a pleasure serving with you on the board as our chair. It's a pleasure being here today in person. It kind of brings me back to the old days when we always gathered, and perhaps we can do this on some sort of a periodic basis, at least in the future. But I'll conclude by saying I'm just very pleased that you're still staying on the board, and we get to still kind of collaborate with you in this work. So thank you.
Thank you, Anthony. Anthony, many times I've called on Anthony to chair a committee or to help with something, and always a very willing person to lend his expertise to anything that we ask him. And thank you very much, Anthony, for your kind words.
Absolutely.
Any other board members like to make comments?
Yeah,
I would like to comment. Mr. Boyd, I just wanted to say your dedication to the board has never gone unnoticed. Your professionalism, your kindness, is one to be emulated in how you conduct the board. And you're really a mentor to all of us, even though you may not have met us all, or we're not as, as up close with you, but how you handle the meetings and all that, it's really been an example to all of us. And I just have appreciated being a part of this board and under your leadership.
Thank you, Dr. Rucker.
Yeah, I would like to say that I think the professionalism of the meetings that you've had, that's why I'm in a tie today. I saw Russell this week and I wasn't in one, so he knows I'm not a tie guy, but certainly did not want to miss today. And I think your private background, that you had prior to coming to the board, George has greatly benefited from that and that wisdom. And I think it's great for board members like me that are newer to the board. I do have a healthcare background, but even though you didn't, the background that you had was wonderful, and it's exactly what Georgia needed. And I think that's what makes the board so unique, is we all have various backgrounds. And I think you bring in your professionalism, and everything that you've done here has set a really great example for Chairman Folsom, which I've known for years. And I know we're going to be in good shape for that. And so, and I'm really looking forward to that. But I will say that you really have left us in great shape. And I think Georgia is better for it. And so we appreciate your service.
Thank you, Shane. Thank you very much for your kind words.
And this is David Cruz. I just want to say I agree with all that's been said. I'm one of those people who's been around state government, local government a long time, seen a lot of boards, a lot of board chairs, and Norm, you've certainly have set the bar high for Chairman Folsom, and certainly we all appreciate you and your leadership. You've just done an outstanding job, and we thank you for your service.
Thank you, David.
And Norm, I'm new to the board, but I just want to thank you for the warm welcome that you gave me when I was appointed. And just as everyone else said, I do want to commend your stellar and seasoned leadership. Thank
Thank
you.
you, Dr. Ruth.
If I may say a few words, Chairman.
Certainly.
Okay, thank you. I just wanted to say, Norm, it's been a pleasure working with you for the past 11 years, I think. And I'm appreciative of the rapport and the relationship that we've developed over the years, and I look forward to continuing to work with you.
Thank you,
You're
Denisha.
welcome.
Anyone else before we move on with the agenda?
Mr. Folsom, I had one last little personal point here. It should be noted that Mr. Boyd's an Indiana Hoosier, and I don't know if you looked at the college football playoff bracket, but should things go well in South Bend,
Yeah.
Bring them on.
we might need to, say hey to them on Bourbon Street at the Sugar Bowl there. So we'll see how that goes.
I would love to do that. That'll put me in a dilemma because I've been in Georgia now for 30 years and become a Georgia fan as well as an Indiana fan. So, but I hope we get a chance to play that game.
Yes, sir.
Norm, this has been special and warming to hear all the accolades paid to you this morning, and they're well deserved. I will certainly have to be taking some sort of medication to increase the size of my feet to grow into your shoes, and I probably will appreciate your continuing to be a mentor and guiding me as we proceed forward. So, if no one else has any additional comments, we'll move forward with the agenda.
Thank you, Roger.
The next item is the Medical Assistance Plan, State Plan Amendment, Program of All-Inclusive Care for the Elderly. We will be considering this for final adoption, and Brian Dow, the Deputy Executive Director, will present to us. Brian?
Thank you, Mr. Chairman, Commissioner, and members of the board. Today, I am presenting for final adoption an amendment to the Medicaid State Plan to include the Program for All-Inclusive Care for the Elderly, or PACE, effective January 1st, 2025. As a reminder, PACE is a Medicaid service delivery model. It provides comprehensive medical and social services to individuals 55 or older who meet a nursing facility level of care and are living in the community. PACE is a program duly funded under Medicare and Medicaid. It's an optional Medicaid benefit that members choose to elect. Once the member elects PACE, the PACE program becomes the sole source of Medicare and Medicaid services for the members who elect the program. This would include all medical services like doctor's visits, labs, prescriptions, hospitalizations, durable medical equipment, and what we traditionally think of as home and community-based services such as personal support services, adult day health, or home-delivered meals. PACE services surround a center where participants can choose to visit. An interdisciplinary team of health professionals provides PACE participants with coordinated care. And the centers all have an adult day health center, clinic, and other on-site services such as therapy. PACE organizations can be nonprofit, private, or public entities, and organizations are chosen via a competitive request for proposal process specific to certain delivery areas by zip code. For the board's awareness, DCH held a public town hall meeting on PACE on November 15th, 2024. That's outside of our normal board process. And there was really a robust participation in it. We had well over 100 people online. And I don't know how many people were here, but there was quite a few people here in the boardroom with us as well in person. The opportunity for public comment on the proposed change was held November 18th, 2024 at 11 a.m. via Zoom hearing, and written comments were due to the department on or before November 25th, 2024. DCH received no oral or written comments on the proposed change to adopt PACE in the Medicaid State plan. I'll pause now to answer any questions you have and will respectfully request final adoption of the amendment to the Medicaid state plan to include the program for all-inclusive care for the elderly. Thank you.
Any board members have questions for Brian? Hearing none, is there a motion for final adoption?
Very Mobley motions.
Shane Mobley has made a motion for final adoption. Do we hear a second?
Second, Williamson.
Anthony Williamson has seconded. Any further discussion? Hearing none, all those in favor by aye,
Aye.
Aye.
all opposed no. Any board member abstaining? Motion carries. Thank you, Brian, for your presentation.
Thank you, sir.
Do we have any new business that needs to come before the board before we close this morning? Any closing comments from anyone? Well, if not, Norm, again, congratulations and thank you for your longtime service as chair. Wish everyone a Merry Christmas and a Happy New Year and look forward to seeing you in the bright 2025.
Mr. Chairman, it would do, if we have what Mr. Mobley wished to say one
Oh,
more.
I'm sorry, Shane.
That's okay, Mr. Chairman. I just wanted to thank DCH and all the people that work at DCH that help make the state run very smooth. You know, there's so many people that the DCH takes care of, and there's so many people working behind the scenes. It's impossible to know everyone, but I really want to recognize everyone for doing a great job this year. And also, I can't recognize Denisha enough. She does a great job, and I really appreciate everything that you do. You know that, and you make us all look really good. But most importantly, the state of Georgia. I see Joe back in the background, Joe Hood. He does a great job. I saw him this week. There are a lot of people behind the scenes that are just incredible people. And I've said this before to multiple people, just how great shape our state is. I can't speak for other states, but I can tell you that the people that are on this board and I know the people at DCH truly care about this state. And that makes me feel really good about the thought process that goes into a lot of what happens at DCH. And I do not take lightly, as well as I know the board members don't. We take it very serious, everything that we do. And I can't thank you guys enough for that. And everything that you do, Mr. Commissioner, the hits that you take, the work that you do behind the scenes that people really don't know about. But I can tell you that I really appreciate that, and Georgia's better for that. So I know I'm probably leaving a lot of people out because it's impossible to know all the people that work here and all the other people that we work with that work with us. But it truly does take a great team. And I would tell you, if this was a publicly traded entity, we would probably be the star on Wall Street because everyone here does a great job. And I was talking to someone recently about how well the presentation is always put together and the thought process on the numbers and how fiscally responsible the department is. And that makes me feel so good about being a taxpayer, sometimes more than I want to be, Mr. Commissioner. But it does make me feel really good for that. And then I'll conclude with this, that I'm looking forward to working with Chairman Folsom. He brings a wealth of experience. He's been in healthcare. He's I don't want to embarrass him a lot, but he's sort of a legend where he comes from. And so he's involved in a lot of things and he's got a lot of great experience. And so I think we're going to be in great shape, and I'm looking forward to serving with you, Mr. Chairman, this year and for many years to come. So thank you for taking on this role. I really appreciate that. Merry Christmas to everyone.
Thank you, Shane. You're inflating my stock. Thank you. If there's no other business to come before us, we stand adjourned. Thank everyone. Norm, have a great day.
Okay, thank you.
Merry
Thank you.
Christmas.
Merry Christmas.
Merry Christmas.